There are approximately 70 million cats kept as pets in the United States alone. Because a majority of households consider their cat to be a part of the family, preventative vaccines are a vital element in the fight against infectious disease. Just as in the dog population, cats are vaccinated against the most threatening infectious diseases. In this program dedicated to our feline friends, we will address each individual disease, commonly presented signs, and the applicable vaccine. The American Association of Feline Practitioners, or the AAFP, established guidelines and recommendations similar to the AHA Canine Vaccine Task Force study. The vaccines are grouped into categories called highly recommended, recommended, and not recommended. According to the study, highly recommended vaccines are those that all healthy cats should receive in one form or another. Recommended vaccines are optional and should be administered selectively based on the veterinarian's specific recommendation. Vaccines that fall in the not recommended category are due to lack of existing evidence that the vaccine induces clinically relevant protection. As with most vaccine protocols, the diseases cats are routinely vaccinated against are chosen due to a history of being highly infectious or carry a significant mortality rate. We will discuss the FVRCP, rabies, feline leukemia, and feline infectious peritonitis vaccines. Let's begin with a discussion on the FVRCP vaccine. The FVR stands for feline viral rhinotracheitis, a disease caused by feline herpes virus type 1 or FHV1 and affects both domestic and wild cats. The virus is a member of the herpes virus family and is shed through the mucoid discharge from an infected cat's eyes, nose, and mouth. Contact with these secretions is considered to be a potential mode of transmission. However, the most common method of infection appears to be contact with contaminated objects that an infected cat has touched or sneezed on, such as bowls, food, and toys. The main presenting sign of an infected cat is sneezing and a mucoid discharge from the eyes and nose several days after exposure. Typically, several days of close contact are necessary for infection to occur. Unfortunately, the illness can lead to permanent damage of the nasal passages, producing a lifelong sneezing problem. The AAFP highly recommends this vaccine. The C represents feline calicivirus, or FCV, and affects all cats. This virus may infect cats at the same time as the rhinotracheitis virus and is considered to be the cause of a large percentage of all upper respiratory infections in cats. The organism is spread primarily via direct contact with an infected cat's mucus. While FCV is similar to rhinotracheitis in terms of causing nasal and ocular discharge, it differs in that certain strains of the virus create painful ulcers in the oral cavity. Presenting signs include oral and nasal discharge, flu-like signs, and pneumonia in the latter stages. Cats that have previously been infected with FCV will likely become persistent carriers of the virus. The AAFP highly recommends this vaccine. The P represents panleukopenia, a disease caused by feline panleukopenia virus, or FPV, and is often referred to as feline distemper. The virus is actually caused by a parvovirus, is very contagious, and spreads via the oral fecal route. Food bowls, toys, litter boxes, etc. is suspected to play a role in transmission of the disease. The virus affects three major systems: gastrointestinal, nervous, and immune system. Clinical signs of infection are similar to canine parvovirus and include fever, inappetence, lethargy, vomiting, and diarrhea. Panleukopenia has a high mortality rate among kittens under the age of 6 months. Additionally, if a female cat is infected while pregnant, she may either abort or give birth to stillborn kittens. If the infection occurred during the latter stages of pregnancy, the kittens will likely have neurological problems. The AAFP highly recommends this vaccine. The next vaccine we will discuss is the rabies vaccine. According to the AAFP, more cats than dogs are infected with rabies in the United States. In mammals carrying the rabies virus, the virus concentrates in the saliva and thus spreads primarily from a bite wound that breaks the skin. Once the virus has entry into the dog or cat, it migrates up nerves into the spinal cord and eventually ends up in the brain. Shortly before the virus has made its way to the brain, the disease becomes transmissible and signs present. Although quite variable, the first stage, the prodromal stage, has been reached when the animal's larynx begins to spasm and a personality change occurs. The excitative stage soon follows, and it typically presents as paralysis of the throat area, causing the inability to swallow. This paralysis tends to be mistaken for an animal that is scared of water or is mad, as evidenced by the foaming at the mouth. The last stage is termed the paralytic or dumb stage. At this point, the affected animal will suffer from general paralysis that leads to death. Specifically, the animal is unable to breathe due to paralysis of the muscles which control breathing. Treatment of infected cats that have developed clinical signs is not considered effective and is therefore not recommended. Because of its zoonotic nature, rabies is one of the only vaccines required by law in many regions of the country. Each state or municipality has laws specifying the age at which an animal must receive its first rabies vaccine and the interval in which subsequent boosters should be given. This interval ranges between 1 and 3 years, depending on the age of the cat, the type of vaccine, and local regulations. The AAFP highly recommends this vaccine. The next vaccine we will discuss is the feline leukemia virus vaccine. Feline leukemia virus is believed to cause more deaths than any other feline infectious organism. The virus is transmitted through infected saliva, tears, and urine. Mutual grooming, bite wounds, and in utero are other common modes of transmission. The virus typically affects lymph nodes, bone marrow, and intestinal tissues. The virus typically causes immunosuppression, tumors or other abnormal tissue growth, and profound anemia. Outdoor cats are at greater risk due to their increased likelihood of being bitten by an infected cat. This makes it very important to get every cat that has exposure to free-roaming cats vaccinated prior to contact, and to test all cats in the household to make sure they're free of infection. The AAFP recommends this vaccine based on risk of exposure. Prior to a cat being inoculated with a feline leukemia virus vaccine, a blood test should be performed. Cats confirmed to be infected with feline leukemia need not be vaccinated, as there is no current evidence suggesting the vaccine is effective in viremic cats. The last vaccine we will examine is the feline infectious peritonitis, or FIP vaccine. FIP is caused by a coronavirus that is transmitted via the oral fecal route. It is estimated that in most multiple cat environments, like some shelters and catteries, 35 to 75% of cats will be infected with feline coronavirus and shed the virus through the feces at any given time. Although many cats are or have been infected with feline coronavirus, only very few will develop FIP. The presenting signs of the disease can vary greatly, making the disease fairly difficult to diagnose. However, fluid buildup in the abdominal cavity, weight loss, and fever are common signs. Affected cats rarely survive, and kittens carry the highest mortality rate. At this time, controversy surrounds use of the FIP vaccine. According to the AAFP, some studies demonstrate protection from disease, while others show little benefit from inoculation. Therefore, use of this vaccine is not recommended for routine use. A discussion about feline vaccines wouldn't be complete without addressing the importance of injection site protocols and vaccine-associated sarcomas. Why are these issues of concern? Veterinarians have noticed an increase in the incidence of sarcoma formation at commonly used feline vaccine sites in the last several years. The exact cause of the tumors is currently unknown, and the incidence of these tumors is estimated to be 1 in 10,000. Although lumps at vaccine sites are fairly common, the Vaccine-Associated Feline Sarcoma Task Force recommends biopsy if any of the following are seen. 1. The lump persists for more than 3 months after vaccination. 2. The lump is larger than 2 centimeters in diameter. Or 3. The lump is still increasing in size 1 month after vaccination. This concludes this section on feline vaccines. After viewing this program, Technicians should be armed with an improved understanding of common vaccines, infectious diseases, along with typical presenting signs, and will be able to confidently deal with the inquiries from concerned clients.